Welcome, Dr. Angela. I can't wait to talk to you all about pelvic health. I have a million questions for you. But before we begin, can you tell us one thing that you did today to take care of you?
I went to the coffee shop and had a monster cookie because that's my favorite. Does that count? Can that count?
It's all independent, right? It's what is self-care for you, right? It's not like from
It's
an
what I
outside
felt.
person.
It's what I felt I needed.
Well, that then, yeah, if you're listening to your needs, like that's the way to go. So can you tell us a little bit about you and what it is that you do?
Yeah. So I'm a doctor of orthopedic and pelvic floor physical therapy. I'm also a mom of three. So I just feel like that's such a big part of it too. So I've experienced it. I've had personal experience three different times. Every birth experience is different. Every postpartum is different. Um, And but also I'm a runner and a triathlete. And so I love to be active and be outside and play with my kids and run and jump. And um, I did not well, after my first baby was born, I didn't know how to get back in that space because I just felt like, what do I do? How do I move my body? How do I not pee my pants? And so I was like, I think that moms need support here. And so that's what I do. I bridge that gap of like, it's not just Kegels, you need more than that. It's not just looking at just the pelvic floor, it's looking at how you are moving your body. And your thoughts, your thoughts impact how you move and how you breathe. And there's so many things that go into it with how I support moms. Um, but that's what I do.
Amazing. So did you work with moms before you became a mom, or is that when you really transitioned into that area of focus?
That's when I transitioned. I was like, so I was a collegiate runner. I ran cross country and track in college. And so me saying that, it's like, I know how to be active. I know how to exercise. I know how to run. My husband is also a physical therapist. So we have essentially two eyes, like helping me get back into exercise, right? After baby. And it's like, why is this so hard? This should not be so hard. I know how to exercise. I know how to do ab exercises. I know, like, why is this so hard? And that's when I started going to my first courses for myself. Like I went to pelvic floor courses for me to fix me. And it did help, definitely, but it wasn't until like I really went and dug deeper with how the whole body is connected together, where I started to really see progress, where it's like, yeah, you can actually get back running in 12 weeks after baby. Like that with baby number three, he's 11 months as of yesterday. I was running a 5K, not because I felt like I needed to, it was just because I wanted to. It was a fun thing for me to do with my friend. And so I ran a 5K at 12 weeks postpartum after baby number three, pushing him in the stroller. And I didn't leak. I didn't have any problems. I didn't have pain or prolapse or anything. It's because I knew specifically what to do, also looking outside of the pelvic floor. Does that make sense?
Yeah, and I've been to a few pelvic floor physiotherapists, and every time the focus has mainly been on the pelvic floor, a little bit on the core, but there was no talk about any other part of my body. So I find this really interesting. I think that your way of working is so useful and makes so much sense because everything is connected, isn't it?
Mm-hmm. Mm-hmm. Yeah. And, so I was working with a client just yesterday. Everything I do is virtual, which I love. I love doing it virtual. COVID really opened my eyes to the fact that, hey, this can work and you can do this completely virtual, which works really well for moms. um, but I was working with a client yesterday. Most of the people that I work with in a coaching capacity, because I have the membership and coaching. And so most of the people I work with on the coaching side, she had already been to a pelvic floor therapist, and most people have already been to a pelvic floor therapist, and they get like good information, but like they don't get to the next level, right? Or it's like super slow, or you just kind of get, they just kind of stop at the pelvic floor. And so for her, I was in a few of her sessions like that she went to for the pelvic floor therapist in the clinic. The therapist had given her squats and lunges, which are good, but like there were things that she needed to do to make them better. And so that's where I'm looking at, how are you loading your foot? How are you sitting into what I call your butt crease? Like little things that I like to just make it easy and relatable. Um, what are you doing with your bee stinger? That's what I call your tailbone. So just really simple things, because all of that impacts how you're loading and the impact you're putting on your pelvic floor.
And I imagine that impacts alignment too, doesn't it?
Oh yeah. Yes. Yes.
So why is our pelvic health and the strength of our pelvic floor so important?
It's important because it impacts your back. It impacts your, like back pain can go into it, and um it impacts how you breathe and the energy that you have during your day. Like for me, I've experienced bladder leakage. I've had painful sex. I've had prolapse. I've had or like stabbing back pain, backstabbing pain in my SI joints. And what for me, when I feel those things, I am not my best mom. I am not my best self. I am overwhelmed because I don't feel good in my body. And you can be doing all the like right things, but doing them maybe not in the best way. So like squats and lunges, like I mentioned, like they are really good things to do um, when you're doing them the right way. And so I just kind of like to shift the focus. And that's another unique thing of how I work with my clients, because you don't have to be doing more things. Like you're probably already doing the right things, but when you shift the focus and it's like, instead of doing more things, which is like, oh, I'm a mom, I already have so many things. Right. But if you're already doing the right things, you just have to change how you're doing them. And then it's not overwhelming. You're like, oh, I just need to move this like subtly different way. And that's where I like clients, again, they'll send me videos and then I'll break it down and I'll be like, right here, that's where you need to just clean that up. Move, focus on this when you're moving, when you're picking up your kiddo, when you're bending to put something in the oven, like whatever it is, right? And then you're working on moving better, feeling good in your body, and that's going to leak out or like ripple effect, maybe ripple effect into every area of your life, right? Like if you don't feel good in your body, I'm much more likely to spend money on things that I don't need because I'm just trying to make myself feel better. Or what is that, impulse shop, or just, I don't know. There's so many different ways that it matters. Relationship wise, if I don't feel good, or um if I think that sex is going to be painful, I'm not going to want to be intimate with my husband. Um, so I mean, there's just so many ways. Does that answer your question?
Yeah, absolutely. And one way that it affects you from a psychological level is it really helps with like your nervous system regulation and your emotional regulation, like your core and your pelvic floor. If you don't feel strong in that, you're less likely to be emotionally stable. So if you have that stability in your body, it
Mhm.
that actually ripples out into your emotional health too. So there's just endless reasons why it's helpful to work on our pelvic health, aren't there?
Yeah, I mean, and I think safety too is like a big, maybe word that kind of bridges. If you don't feel safe in your body, it's really hard to feel safe emotionally, mentally, right? And then it matters for how you're raising your kids. Like if you are a nervous wreck or overwhelmed, and just because you don't feel good in your body doesn't feel safe, from just a perspective of like, you feel like every time you bend over, it's going to break your back, like then you're not going to be the calm person that you could otherwise be for your kids.
Yeah, 100%. What are some of the red flags that our pelvic health isn't as good as it should be? Is it all those things that you mentioned, like prolapse and back pain, or are there other clues that will tell us maybe there's something we need to work on here?
Sure. Definitely the things I mentioned. But then to prolapse, this isn't to scare anybody, but 50% of women have prolapse, and so it's a pretty high number. um, Not everybody has symptoms with it. And sometimes I've worked with women that have had prolapse symptoms, like they went to their doctor and they had pretty dramatic prolapse symptoms, but their prolapse was actually like it's graded on like a grade 0 would be no prolapse to a grade 4 is surgical, where the organ is falling out, not a good place to be. And so they had just a minor, like grade 1 or grade 2 prolapse, but their symptoms were so dramatic, like pelvic heaviness, falling out, feeling like it felt very dramatic. But instead of the symptoms being their prolapse, it was actually pelvic floor tension. So think about like if you've been flexing your bicep, I like to use analogies, okay? So if you've been flexing your bicep for 5 hours, it's going to feel heavy, right? Now you put that in your pelvis and then kind of the same thing, that fullness, heaviness, and when you feel those things too, sometimes like I'm not immune to these problems. Like just because I'm a pelvic floor therapist, I also have these problems happen. But for me, when I feel those symptoms, and I'm probably more in tune with my body than the regular person, normal, somebody that's not a pelvic floor therapist, it gives me a little insight. I'm like, oh, my body is telling me to slow down. My body is telling me I'm overwhelmed. I need to like down regulate, go for a walk, maybe don't look at my phone, or just like have connection with people or something, right? I need to like regulate my nervous system because your nervous system impacts your pelvic floor. Your question was, what are symptoms? So things like if you have to pee all the time, like if you feel like after kids or just like in general, because I had pelvic floor problems before kids, which we can talk about, but um so if you feel like you have to pee pretty frequently, or you feel like you have a strong urge, like you just when you pee, you have to pee right now, that's a signal that there's you have a pelvic floor problem. It's not just that your bladder got smaller after kids. It's not just because you're getting older. It's not because you drank too much water. Those are all things that I hear. So so yeah, if you feel like you have to pee all the time, if you feel like you have to push your pee out, or if you feel like you have to push your poop out, like constipation can be a pelvic floor problem. Um, Other things like back pain, tailbone pain, painful sex. I think the obvious things would be if you leak or you pee when you cough, sneeze, run, jump, like those things, pelvic floor. If you feel or the other thing is your abs, like if you have a lower belly pooch, and that's not like meant to be cosmetic thing. It just means that you're not using your abs in the best way, which matters for how you're able to breathe. Um, so things like TMJ, that can be a pelvic floor problem. Even things like plantar fasciitis can be a pelvic floor problem. You're like, oh, what the heck? Yes.
So everything comes from the core. That's where all our strength originates.
Yes. Yes. A diastasis. So like, or a hernia, even like an abdominal hernia could be a pelvic floor problem. Um, so many things, so many things.
With hernias, like umbilical or abdominal
Mhm.
hernias,
Mhm.
working on the pelvic floor, is that going to help improve that, or is surgery still required?
I think it depends on that one. I think it depends on the severity of it, how much pain there is. So let me, so just think about your core. So like right now, I'm just touching my midsection, okay, like my belly. So think about that like a balloon, right? So if you think about your midsection like a balloon, where the top is your breathing, that's your respiratory diaphragm, right? That goes all the way around the base of your ribs. And so the top of this balloon is your respiratory diaphragm. The bottom is your pelvic floor. So your pelvic floor sits inside of your pelvis. It forms a diamond from your pubic bone in the front, your tailbone in the back, and then your sit bones on the side. Diamond. Yeah. And then this core balloon. So you have your breathing, your respiratory diaphragm, pelvic floor. And then the surrounding sides are your deep abdominal muscles. All right. So this balloon only works when it is positioned in this good, like stacked position. Other people will call it a canister. That's another word that some people will use. So it's a canister, right? And so if this balloon, I don't even like to tell people that their pelvic floor is weak. I like to say that it's not coordinated. It might be weak, but it's probably more so not coordinated. And that's the bigger issue. And then once you have it better coordinated, and these things interweave together, but once you have it better coordinated, then you can add on getting stronger. You can add on doing all the ab exercises and all of the, I don't even teach people Kegels, to be honest, but you could add on more specific pelvic floor awareness. But so with a hernia, an umbilical hernia, let's say, that's the leak. That's where your pressure was leaking. With a prolapse, that's where your pressure was leaking. If you have a disc herniation, herniated lumbar spine, a herniated disc, that's where your pressure was leaking, because the front and the back, the bottom, the top and the bottom, that's your whole balloon. So I will teach this same exact information to people, obviously, that have come to me that want to work with me for pelvic floor problems, for prolapse, but I will also teach it for things like back pain and ab strength and a diastasis, and even things like this matters even for your shoulders, because if you are not stable here, then you're literally holding yourself up. Does that make sense? Like I'm sorry, for people that can't see me right now, I'm shrugging my shoulders up because now I'm using my shoulders to hold myself up because I'm not using my good abs to coordinate. Does that make sense?
Yeah, so we're compensating with other parts of our body because our strength isn't in the core.
Yes. And then if you don't have this good coordination in your deep core, maybe it's not positioned to do so, it's not coordinated. So this goes back to looking at things like if your muscles are tight or if your joints are in weird or wonky positions, like making sure that you're set up to coordinate this the best way. So that is looking at things like posture. But there's no perfect posture. Like you don't want to be rigid. But if you are thinking that this is good posture and you're shoving your shoulders back and you're sitting up super straight and you're actually just throwing yourself into this shallow breathing pattern. So now maybe you've worked on your breathing, and you've heard or you've read that you need to breathe deeply and do some good like calming breathing. But if you're positioned and you're shoved up here, your diaphragm is also positioned up here and you're going to breathe shallow. So you might take a really big breath, but you're actually just filling up your shoulders and your chest. And that's where TMJ things can happen because you're just like tense. You don't actually take this good breath into your pelvis that I will coach people to do.
So is breathing one of the main starting places to learn that positioning and that coordination?
It is. And not to sound, I don't know the right word, not to be confusing, but I will teach people the breathing, but I won't have people get stuck there. So, because that's something I see happen a lot too, is that people will get stuck on the breathing. I'll teach it to them, and then I like to just move on. Like, I want you to practice it, but I want to also move on, because if you aren't strong in your hips, if you're not coordinated in your hips and in your abs, the breathing might not be possible for you. Because I like to tell people that it's not just the pelvic floor, right? Like, from everything that I've talked about already, instead of blaming the pelvic floor, you need to work to support the pelvic floor. Like, there is a reason that the pelvic floor is tense or not working correctly. It's because it's not being supported. And so, yes, I want people to understand the breathing, to breathe into your pelvis, and I'll teach people strategic positions so that they are most successful with it, because I'm not just going to be like, breathe into your pelvis and good luck with that. So I'll give you specific positions that will help you be successful with it. But at the same time, like, let's also move on and make sure that you're working on getting strong in your hips and working on being able to lunge and squat and bend and move your body in a way that supports your pelvic floor.
Right. So it is it's involving a lot of different components, isn't it? It's not just focusing on the pelvic floor. And that makes so much sense because that is only one small part of the body, isn't it?
It's such a small part. And then if you think about, I said plantar fasciitis earlier, like, if your hips are not strong or not coordinated, you're literally going to grip the ground. Your feet will grip the ground because they're just trying to hold on. Right? And now plantar fasciitis, or maybe your ankles are always tight, your calf muscles are always tight. It's because you are not using your hamstrings. You are not using your inner thighs, and those attach to your sit bones. And your pelvic floor attaches to your sit bones. So you need to use those muscles to support the pelvic floor. And so I'll look at things like, what are your feet doing? What other things do you have going on? Like, instead of Band-Aid fix this problem and this problem and this problem, like, why not look at the whole body as like, what is your body trying to tell you? What is the problem here?
Yeah, that would end up solving so many problems. And often we don't just have a pelvic floor issue, but we do, as people, have a number of other problems, don't we? So I love that approach that instead of going to so many different professionals, you can just go to one and work on all of these things. That's brilliant.
Yeah.
Okay, so in terms of preparing for birth or even preparing for pregnancy, what are some things that we can do so we don't strain our pelvic floor more or make any of the issues that we already have worse? Are there things we can put in place? Is it about getting that right alignment before we go in, or is it doing squats and lunges and keeping our hips and our core strong? Like, what do you suggest that we do so we go through it more easily?
Yeah. So let me think where I want to start with that, because those are kind of two separate questions. Well, I think for childbirth, you can prepare for that in pregnancy. And the thing to remember is that, or to even know, is that you need to open your pelvic floor to allow your baby to come out, right? In a vaginal birth. And this is all still helpful, even if you end up having a C-section. But you need to be able to open your pelvic floor. Your uterus will literally contract, right? Those are the contractions. Your uterus contracts your baby out. It's your job to open, right? So what I like to say is that the pelvic floor is the gatekeeper for the pee, the poop, and the babies. Okay. And so you can practice having a baby on the toilet when you poop. So you can practice breathing your poop out, breathing your baby out. So that, remember that I said the pelvic floor is a diamond, pubic bone in the front, tailbone in the back, and then your sit bones, side to side, your butt bones. And so you can, when you're on the toilet, pull your butt cheeks out so that you have that diamond open, right? So it's positioned in an open, it's positioned with the diamond open, right? So that the gates can open. And then you're going to calmly breathe into your tailbone space. So you're going to calmly breathe into your tailbone space, and that is going to help you lengthen and open your pelvic floor, which is also going to help you to decrease your risk of prolapse, because that's how, like, pushing is how prolapse happens, bad pressure management. So, and sometimes in pregnancy, it can be hard to poop because you have the hormones and there's, extra like baby pushing on your bowels, right? So learning how to breathe your poop out can really help you prepare for labor. And then regardless of the position, although there are probably, I have favorite positions for labor. But above all else, just remember that you need to have your diamond open. So some of my favorites are hands and knees, because you can really move your pelvis, right? When you're on your hands and knees, or even on your elbows, and then, or on your side, and then watching that you're, again, thinking to breathe into your pelvis and noticing where you are tensing. It's really hard when you're having such intense contractions to focus on all of these things. But what I find to be most helpful, after having gone through it 3 times, I have a whole kind of process at this point. My husband's like, oh, she's going in this position. All right, baby's coming. He knows. He's like, what's your game plan? I'm like, okay, I'm using these positions. I've already thought through it all. Either way. So noticing where you're tensing. And so for me, I'm very aware if I'm tensing my jaw. I think thoughts of like heavy jaw, heavy shoulders, open hands. Because if you are clenching everything, because when you feel pain, right? If your pain response is to tense your jaw and tense your shoulders and tense your hands, you're going to breathe shallow. You're also then going to be fighting the contractions, tensing your pelvic floor. And earlier I said TMJ can be a pelvic floor problem because you're literally bottling up both ends of the system. So again, if we circle back to pooping, when you poop, think to have your jaw be heavy. Notice your pain response, not that it's painful to poop, shouldn't be, but just kind of let your shoulders be heavy and calm and like, and think to breathe. Does that make sense?
Yeah, and it's very different to, I think, about how a lot of people go through birth. There's this pushing phase, right? That's even what people call it. So I
Mhm.
think so many people breathe incorrectly and clench. I know that I almost broke my husband's hand just holding onto his hand so tightly. So I fell into that category without realizing it because I didn't do this work beforehand. I thought I was fit and strong, and maybe I was, but not in the correct way and not putting the correct steps in place, which made it so much harder.
Yeah, and then you're literally fighting your body, like just knowing that I'm not saying I didn't have pain. I'm saying, right, that I noticed where I was tensing, and make sure that you let your hands be open. And then you're kind of like embracing it, right? Like you're knowing that it's going to be okay. My mantra during Axel's labor was fear and faith are both believing in the unseen. And so I just kept, right? Because there's all these things that could happen. There's all these things that could go wrong. And I think if you don't watch yourself, then you kind of you might follow those paths, that thought pattern of like negativity, right? because I've heard, working in my space, I've heard enough, scary birth stories to know that this is possible. Like, but I can also have the ability to be like, I could choose to be scared, or I could choose to have faith it will be okay. Right. And so that's what I kept saying to myself. Fear and faith are both believing in the unseen, and making sure that I was letting my jaw be heavy and my shoulders drop and my hands be open and breathing into my pelvis. And that was simple enough. And it was funny. I gave this same kind of talk. Well, it was a condensed version, like 5 to 10 minutes, with a friend who was induced. And she was she was in labor, and she called me. Actually, she was texting me, and I was like, you were in labor. Why are you just, if you want to speed this up, why don't I just called her, right? Because I'm like, do not be texting me through contraction. So I called her and I'm like, use these positions, focus on these things. And I didn't even tell her the reasons behind it, right? I'm just like, let your jaw be heavy, hands open, shoulders calm, fear and faith, like condensed version, right? Because I know she couldn't be thinking a lot during labor. And here I hear her telling her husband, put the bed this way, move me as I'm talking. And her baby was born an hour later.
Wow.
Yeah.
Yeah, it'd be amazing to have you at births. Do you ever go to births? Because that would be phenomenal for people to just be coached through that. And I guess ideally you learn these things beforehand. So then they're so ingrained that you can coach yourself. But it would be amazing to have somebody there to remind you, because you can forget when you're caught up in all the labor, right?
I have not been to a labor, although I have had clients who have hired doulas before. And they're like, you know what? The doula was great, but you were the one in my ear. You were the one that I was thinking about. And you were the one that you were the most helpful. The things that you told me, which in part are a lot of what we've just talked about. So, but all the positions, and I have a whole like labor prep routine inside the membership for people as well to check out, which is great for working on how to move your pelvis and open up your sit bones and have that diamond be open. And just the better you feel, the better your body feels, the more mobile your body is, the more options you have for movement, right? If like during pregnancy, you were either too scared to move or it hurt too bad to move, like things are getting tight. Like your body you need to move, you need to be active during pregnancy. And this pregnancy, number 3, was actually aside from like varicose veins that I had no control over, it was my best one. Like I didn't have any pain. I was able to still work out into like 38 weeks. I was shooting videos 38 weeks out doing like not deadlifts, but lifting weights still. Um, and it's because I was very aware of how to engage my deep abs and how to breathe into my pelvis and have my sit bones be open and really move in a very intentional way. It's not necessarily meaning you need to do more. It just means that you need to move better.
Yeah, that
And so
seems to be the theme right from the beginning of this conversation. Isn't about, we're not adding more things to do and causing more overwhelm, but changing how you're doing the things you're already doing.
oh yeah.
So you're moving better.
Yeah. I mean, I literally taught somebody how to sit today. Like I'm a therapist who taught somebody how to sit. Right. And when I asked her, because I always ask people, I was like, do you have back pain? And she goes, no, just like if I do too much. And I'm like, all right, just go with me here. I want you to sit while you're sitting here. I just want you to pull your butt cheeks out. Just do it and just don't judge it. I know we just met. She's like, all right. So yeah, she does. And then there's a few more things that I coached her on, but I taught her how to sit. And we just kept going, and we were talking for another 20 minutes, and she just sat the way I told her to sit. And I was like, do you have back pain? And she goes, oh my gosh, my body feels so good. I didn't know that I had back pain until I really don't have back pain. And so then she got up and she's like, normally when I stand up, I'm like, have to kind of work out the kinks And I'm like, yeah, it's because you're sitting wrong, right? If you sit poorly, it's like talking on the phone with your shoulder up to your ear, right? Things are going to get tight.
I imagine we're all doing this wrong. Like we're all probably sideways and crossing our legs and tensing up in odd places. I think everybody could use this, couldn't they?
Yes. Yes. And I'll teach men this stuff too. With my business, I don't work with men with active motherhood, but I mean, I have taught men this before in the clinic, right? So it, they kind of look at me a little funny when I tell them to pull their butt cheeks apart, but I'm like, I do forewarn, I'm like, just, this is going to sound weird. Just do it.
And I guess if you do it and it feels better, hey, they're sold,
Right.
right?
Right. Who cares?
So if we look at kids, I'm just thinking about my kids and other kids I see, they move so naturally. They're amazing at squatting, they're amazing at climbing. Do we have to teach them anything, or do we just have to make sure that they keep moving naturally so they don't have to relearn all this stuff as an adult?
Yes. Sorry, just let them keep moving. Let them keep moving. Also, things like let your kids be barefoot. Let your kids be barefoot. It's so incredible, like how our bodies are designed. Like if you can think about, um, like if you were to walk over gravel or you were to walk on just maybe you have grass that doesn't have weeds in it, sharp, pokey weeds. We have sharp, pokey weeds that are, but either way. So if you're walking on really soft grass where you're not going to get a thistle on your foot versus gravel, like you are going to move your body differently, right? Like think about, so if remember back when there were malls, people went to malls. You could just sit there and you can appreciate that people would walk, like people walk differently. Some people walk differently, right? Some people are what I would call floppy walkers, where they're just kind of like blip, blip, like they just kind of lock out, they're just kind of floppy and they just kind of hang into their hips. Can you think of that person? They're kind of
Mhm.
like laid back. And anyway, there's somebody in my family, I won't name names, but there's somebody in my family who should know better. And he's like, I just have hip problems. And I'm like, or you're a floppy walker. That's what I call it. So, right, because then you're putting more pressure on the labor at the front of your hips, doesn't matter. But anyways, you're not going to walk that way if you're walking on gravel barefoot. You're going to be more athletic. You're going to be more protective of your body and your pelvis. Does that make sense?
Yeah, so he's saying that we should walk barefoot on gravel
Same.
and like almost any time, right?
Yes.
Yeah.
Yes. Walking barefoot is great.
Yeah,
Walking
I do
barefoot.
notice that. I walk barefoot as much as I can, and my kids do as well. And we've got pretty tough like bottoms of our feet. And I notice when I come home wearing shoes and then I take them off, my whole body feels different when I start walking barefoot. And I've never thought about how I move differently, but I do. It's not just a feeling of feeling more connected and just feeling happier, but I do actually hold my body differently.
Right, right. Now that I bring your awareness to it, you might notice that when you walk on, I'm just using gravel as an example, but um, I mean pavement, I mean pavement's really hard, right? So I'm trying to use like natural occurring surfaces like gravel or sand or grass, where when you walk on those surfaces, you're going to naturally engage your core. You're going to naturally engage your abs. You're going to spread your toes more, or you're going to be like one reason too that shoes are bad is because they usually will tuck your toes in. They'll scrunch everybody in, right? And now it's like your little you took away this nice surface area of how your body can connect and how you can move better and access better muscles. Your Well, for example, like your heels will help you activate your hamstrings.
Stepping on your
Okay.
heels?
Well, just like engaging, like, maybe that's not a good example. I mean, it is a good example, but I don't want to confuse people. Don't only step on your heels. Don't only, okay. But how your heel contracts the ground will help you engage or could help you find your hamstrings better, because how you load your feet impact what muscles you use up the chain. So if you're in shoes that your toes are all scrunched in, right? Or if your ankles are tight or your toes, like, it matters for how you're going to load and what muscles you're going to use in your knees and your hips and your pelvis. Does that make sense?
Yeah, it does. It makes so much sense. I remember when I was doing some yoga and Pilates when I was pregnant with my first son, and they had us doing a lot of toe and foot exercises. And they were really hard for most of the class because we're not used to that. We are so used to having our feet just squished in shoes, and that's it. We don't think about them. But it was amazing how moving them and stretching them and spreading them, like what that did for, I don't know, our whole body almost. It felt different.
Yeah. I mean, your body, or your feet are meant to, like, your toes are meant to move. Your feet are meant to make shapes. They're meant to be rigid and be able to absorb impact. And if that doesn't happen, then maybe if you're the person that you're dealing with bladder leaks when you run, have you looked at your feet? Right? Are your feet rigid? Are they just collapsed down? Like, those are some of the things that I look at. And it's not just, I mean, maybe you need to look at what muscles you're using at your hips to better support your feet. Like, it's kind of chicken or egg, like they all need to work together. So, but oftentimes what I hear people say is that I mean, these are just some examples, but they'll say, I have bunions, I have flat feet, I have rigid feet, I overpronate. And they just kind of take whatever diagnosis they've been given or whatever like problem they have as like, this is just how it is. But think about, like, so for like a bunion, right? Your feet are like your hands. And if your finger was all twisted over and you had this, would you just be like, well, that's just how my pointer finger goes. It doesn't go straight. I mean, maybe it does, but like, you'd probably do something about it. Right? Or you'd be like, well, I just have rigid hands. Right? You would be like, well, no, I need to work my muscles. I need to move my joints. Like, you wouldn't just take it at bay as just how it is. You would get more curious about it, and you wouldn't be so particular about it. What I mean by that is, oftentimes too, when I tell people to do things with their feet or work on their ankles, they're like, am I pushing on the right spot? Am I doing the right thing? And it's like, well, if it were your hand, because you're not overwhelmed by your hand, you would just be like, no, you just massage it, you'd move it, you wouldn't think about it, you would just do it. Does that make sense?
Yeah, we're more disconnected with our feet, aren't we?
Yeah. And so then people, when you're disconnected from something, it can feel overwhelming when it doesn't have to be, especially with the analogy I just said. Your feet are like your hands. Don't overthink it. Just move it, shake your heel, do move your toes, give yourself a hand foot shake, which is where you interweave your fingers into your toes. And then you just move it all around. I would do it on clean feet. Otherwise it's a little bit gross.
I bet that'd feel amazing though. I'm gonna do that after this call.
Yeah.
So where can people go to find out more about what you do and to work with you? Can you tell us a little bit about your two ways people can work with you? You have coaching and the membership, is that correct?
Yes, yes. So everything is Active Motherhood. Everything is on my website. So activemotherhood.com. But yes, there is the elite coaching. That's what I call it. And that's for people really that want they just want to be told what to do. They want to do it with confidence. They don't want to have to like wonder if they're doing the right thing or when they're doing the right thing. And it really helps people move forward very quickly, because I will have them send me videos. I'll do customized programming for them. So based on their intake, so I have a full workup, full intake form, for full posture and movement analysis. And so based on what I see, then I'm like, this is what you need right now. And then also based on like what your, not only what your problems are, but what your goals are, right? Like this is what you need right now. And then we have coaching calls. So like I'll Zoom calls. And so I'll just coach them through things, and it helps them move forward a lot faster, right? Because it's like it could literally be like 5 therapy sessions in 1 week. Like you're literally moving forward so fast because I can send you new stuff every day versus like having to wait for the next appointment and the next appointment. It's like, nope, you're just going to get it all as you need it. If you want to go faster, if you want to go slower, you have access to me on your phone. Everything is, you can you complete it, you just hit a checkpoint or check mark, and then I'm notified that you did it. So there's also the accountability factor. And so if you have questions on it, I just chat with people on there. I'm like, oh, how did that video go for you? I saw you did it. How'd that feel? Right. There's also, you might appreciate this, I have mindset exercises that I require people to do too. So because if you are that mom that's overwhelmed or not confident in yourself, your posturing is going to be different based on your thoughts, and that's going to impact your pelvic floor. So then I have things where I'll kind of coach people through that, depending on it. It really just depends because that is all customized. So that is my lead coaching. And so to do that, it's activemotherhood.com/apply. And then I also have the membership. So that's 8 different programs. You get access to all the programs in the membership. It's super affordable. Right now it's only $29 a month. In July, it's going to move up, but there's going to be an annual option. So it'll still be $29 a month with the annual option. But then it will bump to $49 a month, July 1st. Either way, there's also a monthly group Q&A. So you still have access where I answer questions. There's a Facebook support group. But the 8 programs, there's one specific for pregnancy, childbirth prep, postpartum. There's an exercise library with over 80 exercises in it. There's a raise the bar running, a full jump rope progression. Some people leak when they jump rope. So I've built just a whole thing for that. I build things based on my experience and based on what I see people need help with. So I had an emergency laparoscopic surgery in the fall when I was 6 weeks postpartum. My IUD punctured my uterus. Not fun. Not a great time. Either way, I built out a program for it. So I'm like, what did I do pre-op? What did I do post-op? So that's in there. So that's in my bulletproof program. So that's more like rehab physical therapy that you could kind of think about, where it's like, what would you do for a rotator cuff injury or TMJ, headaches, rib pain, sciatica, back pain. It's a whole lot of stuff. That's
How
all
long
in the
do people
membership.
normally work with you, whether it's in the membership or one-on-one coaching? What's the typical
Sure.
duration?
Yeah. So the one-on-one coaching, that's 12 weeks. It's guaranteed that you're going to be better in 12 weeks. Usually people are back running, depending on like where you're at in your motherhood journey, right? Like if you start working with me and you're 6 weeks postpartum, it might not. It just kind of depends. But typically people are back running within 8 weeks of working with me. And I'm not talking just like 1 mile. It could be 1 mile, but I've had people running 8 miles at 6 weeks, 8 weeks working with me that they've already seen pelvic floor therapists. And it's just because my approach is different. So 12 weeks, you're guaranteed to be better with prolapse, back pain, bladder leakage. But then also with the membership, some people just love it. Like, but some people just stay in there. Like people just stay in there because they just love it. Like there's programs, there's workouts. I also have a program in there within the membership called it's called the Streamlined Workouts. And there's 6 months of programmed workouts in there. And I have people that have done Beachbody and they like this better. Like I'm not trying to be Beachbody and I'm not trying to be Peloton. I'm not trying to be those things. Okay. That is not me. But I'm very strategic with how I program workouts so that I know the common cheats that people do. Like I just know the common cheats that people squeeze their butt cheeks together and they overuse their quads. And so I'm very strategic in the sense that I'll not put exercises in until I'm probably confident that you've already mastered good mechanics. And then we can add in some of the exercises that might impose some cheat patterns. Does that make sense?
Yeah, that makes a lot of sense. And I imagine we're all individual, but there are tendencies that people tend to have, right? There's going to be
Right.
those general patterns of dysfunction that we have.
Right. Yeah. And then with like the exercise library that I mentioned, I think there's almost 90, honestly, exercises in there. And when I'm demoing an exercise, I'm very particular with, I will tell you how not to do it just as much as I'll tell you how to do it. Because it doesn't always help you to know how you should do it when you're not really sure how you might do it wrong. Right. So then I'm like, oh, if you're doing a lunge and you feel it in your back knee, then you need to put more weight on your front leg. So that's just an example. But I'll speak to those things during the workouts and during the short, like 1 to 2 minute exercise clips so that you know that you can be confident that you're doing it in the best way for not only your pelvic floor, but just so you feel good later.
Yeah, it
So
sounds
you're
like an
like, oh,
amazing program that is not just for the pelvic floor, but you'll just have such better alignment and strength and ability.
yeah, yeah. And
And
it's
where do
really
we go for
any,
that one? Oh, sorry.
oh,
Where do we
so
go
yeah,
for that one?
yeah. activemotherhood.com/store, but really you can navigate there from just the website.
Okay. And what were you going to say?
Oh, I was gonna say that, that the membership and the coaching, it could be helpful if your kids are 10 years old. I mean, it doesn't have to be right away after babies, right? Like I have a 50-year-old in there right now doing the membership. I've had people in their 30s and 40s and some kids are 15 years old, so it doesn't have to be right away.
Yeah, amazing. And was there anything else before we wrap up that you wanted to talk about or mention here that I didn't ask?
I don't think so. I just want moms to know that your body is resilient. I think it's so important to just know that your body is resilient. And even if you've been dealing with any of these any of these problems and you feel like you've tried all the things and it's not working, it might be that you need to look at how you're moving, not just what you're doing, how you're moving. And this is what I do.
Yeah, that's amazing. Well, what a beautiful way to end. We are resilient. It is so true. Thank you so much for coming on here and providing us with so much wisdom and information. And I know I am motivated to start looking more at how I'm moving my body and giving my feet those massages and just doing so much more with movement. So I'm sure the listeners are as well. Thank you so much.
Awesome.